In this morning's Health Watch, the effect of health care reform. Now that the historic legislation has passed, we've asked a few folks to tell us how they really think it will affect their lives. Wanda C. is a nurse practitioner. NISSIM HOLAND is a designer. They oppose the plan that Congress approved late last night. We also have two supporters of the bill, environmental consultant Nick Presley and court transcriber Vickie Cunningham. And here as our fact checker and maybe ombudsperson is Cece Connolly of the Washington Post. Her new book about healthcare reform is called Landmark, and we wish you all a very good morning. First off, who has health insurance? Can you raise your hand if you all? Okay, so we have you do and three of our panelists do. One does not. And you in the front are, what was your reaction when you heard last night that this thing had passed?
I was concerned.
Concern, right? And
I thought it was a disaster.
You think it's a disaster. In the back, when you heard that healthcare reform was passed, was
Hopeful, very hopeful.
Hopeful, and
I agree with the hopeful.
yeah, I think there still is a considerable amount of curiosity about how this will all play out and how it will work in our lives. Let me start with you, Wanda, because you're a nurse practitioner. You have a 91-year-old mother, right? What's your greatest concern as this moves forward?
My greatest concern is twofold. Primarily, I'm concerned about maintaining the extraordinary quality of care that we provide to all Americans today, and maintaining that in a system that now is going to contain more patients who will be seeking health care. I'm also concerned that the most important services...
Is this your sense, is the system stretched now? Will it be overstretched? Is that your sense?
I think in some parts of the country, the system is stretched. And I think in some aspects of medicine, the system is stretched. For example, the elderly, care of the elderly is very, very difficult. And also in the emergency rooms, the care can be stretched.
Which ends up being the primary care facility for so many people of these folks, of the tens of millions, 47 million uninsured Americans. How many will have access to health care who didn't have it before?
There's going to be an increase, Harry, of about 33 million people will get insurance over the next several years. It's going to take a little while to kick in. But this is one of the things that the law is hoping to deal with, is the crush at the emergency room. If you get more of those people with some insurance, maybe they'll start going to a primary care doctor a little bit earlier, do some of the prevention and wellness.
Nick, let's talk about your situation, because you lost your insurance, right?
No, I opted out.
You opted out?
Yep.
Because it was a matter of being able to afford it or not, or what?
No, you have to take that into consideration, but I was covered. I was paying a lot of money. I mean, 20%, 30% increase a year over 3 years. We have small businesses, and my daughter was in the hospital. She was sick, and I still got a bill for $6,000 in uncovered procedures or unapproved co-pays and so on. So
you're one
why
of these,
was I insured? You know, was my question.
So you're one of these people who, despite having had insurance, was crushed by the current system.
Crushed by it, and I don't want to feed what I consider a corrupt system.
It's in the sense of the insurance companies?
Yes, I feel I was being extorted.
Yeah, but just because they went up and they went up and they went up.
I have no say. There's no one regulating them.
Right. So how will he end up being served when this bill passes?
Well, a couple things will change in Nick's life. First of all, under the law, he'll be required to carry some health insurance, kind of the way drivers now have to have auto insurance, or he'll pay some penalties that'll go up over the years. But the private insurance market is going to remain. That's not going to disappear. But you'll be able to do a little more comparison shopping, and there'll be more information available about plans.
These panels are supposed to be set up in every single state.
Exactly.
Nobody really knows how they're going to work yet, or how they're going to work, or if they're going to work. NISSIM, what is your greatest concern about this going forward?
Well, my greatest concern is 75% of the Americans were against health care. And just to ram it down America's throat, the way it was done, not in a bipartisan way, that's what I'm concerned about.
And is it about the cost? Is it about what it's going to do to business? Is it going to...
Well, business, companies with 50 employees or over, will be required to
provide
health care.
Yeah, or get penalized.
So if they have 55 or 60 people,
Right.
they'll go down to 49 people. So you'll have job losses.
Right.
So if you combine that with 100,000 businesses and plus the loss of healthcare jobs,
Right.
you're talking about jobs in the millions.
I want to go back to Vicki. You're insured now, right?
Yes.
But you and your husband were in that sort of perfect storm with the economy, losing employment, losing your home.
Yes.
And your husband died in January, and you
Yes, he
feel
did.
part of that was because you
Because
didn't have access to
we didn't have
insurance?
access to health care.
Yeah.
And we went to a charitable hospital and had him seen. They diagnosed him with something that he did not have. And I believe it was just to get us out of the hospital and get him out of their hair. He had a heart attack 12 years ago, and what he wound up really having was congestive heart failure. And the hospital did not diagnose that.
What is your hope then as this moves forward that what happened to you before
Absolutely
will not happen to somebody else?
happen to someone else, that they will have the opportunity to go and have their problems taken care of. And myself, I have high blood pressure. So I have a pre-existing condition, and I'm happy, and a son in college who will be covered until he's 26 years old.
Yeah. Very, very, very quickly.
Very briefly, I just want to emphasize that health insurance does not equal good health care.
Right.
And that it's important that we take charge of our health, and that also we maintain medical standard and medical practice guidelines that are evidence-based, that are created by physicians and nurses and healthcare professionals to maintain the quality of care in this great country.
Yeah.
Otherwise, I mean, that's a dreadful experience, but the most important thing is that he gets the right care from the right doctor at the right time, regardless of insurance
And your
coverage.
concern is that that won't happen in the future. We want to thank you all for taking
Thank
the time
you.
to come in
Thank
and
you.
share your stories with us.
Thank you.
Thank you.
An imperfect segment for an imperfect healthcare system. Thank you
Okay,
all.
sorry.
A lot happens early on The Early Show, weekday mornings on CBS.